Okay, so this video is going to be about your first initial week of testing. So if you have Crohn's, I'm going to try and find out some information on MS and some of the other autoimmune diseases so that I can make some videos up for them to let people know what you're going to go through. So I know with Crohn's, obviously, because that's what I have. You go for the week. We went up Sunday, and our appointment started on Monday. Monday, Tuesday, and then Wednesday and Thursday, and I think we went home Friday. Or maybe we came up Monday and it was Tuesday, Wednesday, Thursday we had appointments. But anyway, the appointments consisted of, the first day was an MRI. It was with dye, so we got it, we had to drink it, and I got sick from it. I know a lot of other Crohn's patients got sick from it, and they say most normal people who don't have any stomach problems also get sick from it because it's a little harsh. So prepare for that, and then they give you like the injection, a little IV, and they inject dye into you, and they do the MRI that way. Then you go and you have an appointment with their GI doctor. I think her name is Lynn, or it's Dr. Lee, maybe even something different. But anyway, she's a very nice lady, and she's a very good GI doctor. So you'll meet with her, and this might be all out of order. You might see her before you get the MRI and so forth. They have you do blood work too. You don't need an appointment for blood work. I know GI you need an appointment for, and the MRI you need an appointment for. But they're a patient-based hospital, so everything goes very quick when you're there, and they're very organized and very friendly, and they like keep your information pretty safe. They don't call you by your name. They give you like one of those little buzzing things that you would get at a restaurant, and it has a number on it, and it will buzz, and they'll call your number out. So they protect your personal information with that. And you never really wait like long. Like I know here in New York, if you go to the doctor, some of them make you wait for like almost 2 hours sitting in the patient room. But it's very patient-oriented there, and they're very nice. So after you do those 3 things, then you go and you see Dr. Burt. Again, this might be out of order. He'll meet with you, overview everything that had happened, some of your test results, a little bit of the procedure, and talk to you about what's going to happen. And then you also get the lovely colonoscopy, which you have to have prep for. And I was actually kind of surprised because when I had gotten it done by the GI doctor in Chicago, normally I've had several of the colonoscopies done, and as you may know, they are not fun to do. And probably drinking that stuff is the worst part of it, but you also get pumped with gas when you get the colonoscopy, and I think they might biopsy a little bit too. So when she did it, I didn't even feel like I had a colonoscopy afterwards. I felt like there wasn't any gas inside of me. I felt like my stomach wasn't bloated or in pain. I couldn't feel the spot that, like, you know, it cramps a little bit when they take it from a certain spot, and everything just is like all messed up. But I didn't feel anything. I didn't feel like I even barely drank the medicine from the day before. I was really surprised. So I take really good care of you. But that's about everything that happens. Then when they get all their results and everything from the blood work and the MRI and the colonoscopy, they will gather it all together, and the information that you provided, and any medical information that your doctor will send them that for like records and stuff, so they can submit to insurance. And then they'll submit to insurance, and it could take up to like 2 weeks. It could be a little sooner, it could be a little later. I know mine was about a week and a half that it took my insurance company to accept me for pre-transplant testing. And at that point is when they match, or they try to match a sibling if you have one to donate. All it is they'll send you a kit in the mail for blood work, and you just have to go get it done, just the blood drawn, and you follow directions and you send it back to them. It has to be stored and everything a certain way. So once you do that, they will test to make sure that to make sure that your sibling's a match or not. Stop it. Sorry, I have this little puppy who's eating my wire. So after they test your blood and your siblings, if you don't have a match with your sibling, they send it to the umbilical cord center, and they look for matches in there. And again, they look for the 6 of 6 matches. With me, they only found 5 of 6. And they could use that too now. So then they look for your match. Now, if you get a donor right away, they'll probably send you back up within a few weeks of that to do your pre-transplant testing. Like with me, they didn't, so I did this back in November. I got accepted in December. We found the donor they found some donor matches in January of 2014, and it's now April of 2014, so it's taken a little while, but we are moving forward with 5 of 6, and that's part of the reason, because they didn't find it right away, or we weren't sure what we were going to do. So with that being said, the next step that you would take would be the pre-transplant testing, which is what you got approved for with insurance. And when they file insurance, they don't file it all at once. They do it in sections. So they'll file some of the paperwork for the pre-transplant testing, and then once you do that, they'll file the rest of the paperwork so you can actually get the transplant. Some people, it takes about 2 weeks, or it could take longer than that because it's a little more serious. Some insurances will cover it, like I know Medicare, Medicaid, and I heard Blue Cross Federal will cover it. Excuse me. A lot of other insurances will cover it. And a lot of them have already, and it's a good thing when they have already, because you could kind of throw that in the face, I guess, so to speak, and say, like, you know, you've already covered a procedure like this, so it's not something that you've never done before, and you're more likely to be accepted. The procedure, if it's not covered by insurance, is $150,000. So they do have a few organizations that you could ask them about that help raise money, and you could do fundraisers to raise the money. Also, if you want to do fundraisers for your traveling expenses, and with some of the pre-transplant testing, you might have to see some doctors or like get like dental hygiene and stuff like that taken care of. So you might consider doing some fundraisers for that. I think that's about it. So I guess I will tell you about pre-transplant testing in the next video.